Everyone, welcome back. We're going to have a discussion or a conversation here at the table. Aude, I want to start with you. You've been offered a job at the marketing and branding agency with Rens. So congratulations with that.
I would love to work with your hands.
So, what is in your room, with the French speaking? So how was it, and what did you talk about? Can you say something about that?
Yes, it was really interesting because we had some people who never heard of SNA. So it was a first for them, and it was interesting because even though it was the first time, they kind of understood and saw some application. And one person had a very nice example of using it in individualized intervention. And instead of asking, what do you do and what do you think others do, is, well, you drink this amount of alcohol. You have the impression that all the people around you are drinking a lot of alcohol, and therefore you will have some difficulty stopping drinking.
Yeah.
Well, are you sure? Could you just go in your peers and your close one and ask them,
Wow.
do you really drink as much as I think? And then they come back and say, well, actually, they don't drink as much as I thought they were. And that's another way to use SNA in a small setting. And it apparently helps the person realizing that, well, if they want some support from their close one with stopping or reducing drinking, well, they actually have it.
Yeah. So they actually, an individual can do their own research, so to say. That's step number one in your own environment, and then you get already your insights. I'm drinking more than other.
Yeah, and they can challenge their own representation and perception of what they think their peers are doing, and then there cannot be a support for them, whereas there actually can be one because they're not drinking as much as they
Great
think.
Intervention coming from the ideas of SNA.
Yeah,
wow.
I really liked it. I thought
great.
it was very interesting.
Yeah, sounds like a very good conversation as well.
Yes, it was.
Yeah. Hans, how was your conversation at your table?
Yeah, we had a vivid conversation as well. A lot of input from everybody, and what I liked, for instance, because that was the question, maybe what I liked, for instance, was the example of sugar intake that one of the participants gave. For instance, you put a lot of sweets on the table, like we see here as well, and maybe you don't eat that much sweets, but it's offered anyway. And a very good example, thought, was a colleague of mine who does a mental health prevention project. And she says, for instance, if you have a group of depressed people, you can use data like more than 20% of the people once in their lifetime have a sort of a depression.
Right.
So it helps people as well to use data like that in order, I am not alone. And
so
it was sort of the discussion
also
in like self-help groups came up and other areas to expand social norm approach, which was enormously interesting to me as well.
So it's connected to that statement of we can break taboos with this, just like this one.
Yeah, of course, we can, and it's well, people do have the opinion that they know already what other people think, but like Aude is explaining, well, maybe you should just ask it in order to find out if it's really true.
I think this is a good suggestion for my mother-in-law.
Your mother,
ask her friends.
The main target of today is help your mother-in-law. That's what we could all agree on.
So, just to go back to that notion of the danger, right? So people who drink less than the average think, oh, I can drink more because I'm drinking less. What do you think about that? Is that one of the side effects of using SNA?
I think Guido can react to that best in a scientific.
Yeah, well, I really don't think it is the case, because people who drink less have a kind of other mindset, I think, regarding, for instance, alcohol or other substances or other behavior. I've got an example. In the older times, before SNA existed, there was a poster by the Belgian Work Against Cancer. And it was to help people or to try people to get quit with smoking. And it was, poster contained an ape. It was not a naked ape, but a dressed ape. And that dressed ape was smoking. And the title was "And You," which meant, in fact, that people who smoke are like dressed apes. And what they did an evaluation, and what it showed was that smokers were not interested in that poster because they didn't wanted to look like a dressed ape, of course. But those who didn't smoke, the non-smokers, they were just strengthened by it. And I think it's more or less the same when you use the social norms approach. People who drink, if we take the example of alcohol, people who drink less, they are convinced that they are doing the right thing. And I don't think they will switch to more drinking because of that social norms approach.
Okay.
Yeah.
Okay. That's how
That's
our
my opinion.
brain works, we might say.
Yes.
Yeah. Thank you all so much for this reflection. After Paul, we get back for some final insights. Sometimes you have these slow insights that you think, there's one more thing which you should mention. So we give some time for that. We have a final round. Did you have some slow insights while you were listening to Paul? Maybe something he evoked in listening to him, or maybe from the... Yeah?
I'm going to put cucumbers in my garden to get rid of the cats. So that's what I
Okay,
found out.
that's what you found out.
Yeah, that's
Very,
what I found
very
out.
important. Get rid of the cats. Cucumbers in the. Okay, good.
You're not going to do that.
No, I wanted to try it on my cat to see if it works, but I think I'm going to do the water instead of Coca-Cola kind of technique, and for my kid to eat more vegetables because he's really into fruits. But now that I think about it, the fruits are there on display and the vegetables are not. So I'm going to put some vegetables where he can see them when he eats, actually. I will try to see if it works.
Good idea.
Yeah.
You got your experiment.
Yeah.
You have yours. Do you have an experiment as well, Guido, to take home?
Experiment, yeah, but what I heard from Paul, it's just reinforcing what we were thinking about how SNA works. It will, if we hear what he has said and how he explained it, I think it's just reinforcing our ideas of the effectiveness of SNA.
Yeah. So, a final round. This was the final conference after 3 years and actually 20 years of working together. Probably the collaboration will continue.
We will continue, and there will be a lot of sustainability and transferability going on the next years and beyond that, because we've been working together and we have new plans already. So this is not the end, but this is the end of the project period.
Yes,
so
exactly.
Yeah.
So any ways forward that you would like to mention, maybe in your research or maybe indeed in expanding?
Well, I have now an agreement with the city of Antwerp that they will use the SNA for alcohol reduction in students.
Nice.
So they agreed to give some funding, so we can start with. It's a much smaller project than this one, but okay, I think every bit can help.
Yes.
Yeah.
And with all the knowledge built, you can build on that and do this. Great. Congratulations and good luck.
You.
Yes.
Thank you.
For you, what's the way forward?
I'm really happy that I've been here in this project learning about social norm, because at first I'm very interested in, as you said earlier, social influence and stereotyping and discrimination. That was part of my PhD thesis. And now I can see ways to actually try to tackle that and work on how to reduce stereotyping and discrimination and maybe sexual harassment. I think there's something there that could be very, very interesting. So this gives me a lot of different ideas, and of course for public health and other behavior with my kid eating more vegetables.
For instance. Well, good luck with that, and you can always ask Rens for some extra work, huh?
Yeah, I know. Thank you so very much, Rens. I knew that I could count on you forever.
Hans, last word for you.
this morning we already were discussing money or funding to prevention. Well, I hope, and I'm already 60, so I'm at the end of my career, but I hope in the next years that the funding for prevention will really rise so that we can expand the good work and really come to a sustainable healthcare, because prevention is really the crux here. Is really needed to make the healthcare more sustainable.
Right. Beautifully put. Make healthcare more sustainable, and the way to do that is prevention.
That's right.
Thank you all. I have one last question for you, because we've been talking about SNA, about prevention all day. And of course now you meet a colleague or maybe a friend or maybe your partner, and of course they ask, how was it? How was the conference? And could you state in the chat, and you get a question, if somebody asks you, how was it, or what is SNA about? What is your answer to that? So what would be your 1 or 2 sentences for that? Can you just type it into the chat so we have one last round of feedback on what you take from this, how you view SNA from now? Just take a moment to some last notes in the chat about how was it, and what would you say if somebody said, what is SNA about? People are typing probably at the moment. Let's see what it...
Everybody's typing.
Yeah. Everybody's typing, for sure.
Yeah.
Connecting misperceptions to increase healthy behavior. That's Paul's message. Sorry, what would you say?
That's really the bottom line of SNA, I think, yeah.
Yeah, connecting misperceptions to increase health behavior. Yeah, Paul's message: there's always a purple crocodile in the room. Good.
Okay.
A positive way to connect. A positive way of connecting the misperceptions. A method I, as a prevention worker, can use. Nice.
Oh, cool.
It's a reality check for Verhaltensveränderung, which is behavioral change.
Yeah,
I think so too. Yeah.
Say,
A non-judgmental comparison between what people expect in their behavior and the actual mean behavior. Nice. A non-judgmental way to convey a message based on facts instead of misperceptions.
That's nice.
Yeah, good. Yeah. A good positive way to talk about the use of alcohol, cannabis, or medication. Yeah. Find own decisions, somebody else is mentioning. Waiting if somebody else will say, yeah. A very interesting tool, especially for prevention and addiction. SNA is a very accepting attitude towards people and their behavior choices. Yeah, it's also about accepting and respecting. I heard that also in the conversations in the World Cafe. Well, I think great takeaways of this day.
Very nice.
Thank you all for joining today in this online final conference. Good luck with all your work, and we'll see you somewhere online or physically. Thanks so much. Bye-bye.
Thank you, everyone.
Thank you.